For the patients with asthma, controlling their symptoms with a safe, manageable regimen of education, self-management, and appropriate medications is a goal. We are now recognizing that there are multiple phenotypes of asthma and that regimens need to be tailored or personalized for best results. Despite our best efforts, severe asthma remains a significant concern and can lead to hospitalization and, unfortunately, death. Trying to assess features or markers of severe disease and then targeting interventions would be helpful. Today's researcher, Dr. Stephen Schworer, is an assistant professor of medicine in the Division of Rheumatology, Allergy, and Immunology at the University of North Carolina at Chapel Hill. Thank you for joining us today, and please tell us about your work regarding mucus plugs seen in patients with asthma.
Thanks for having me. So, as Dr. Rizzo said, asthma is a common chronic obstructive airway disease that's characterized by inflammation, airway hyperreactivity, and also mucus plugging. Many recent studies have demonstrated that mucus plugging is a key feature in severe asthma and the most common driver of fatal asthma events. The understanding of the role of mucus plugging in asthma has been enhanced by recent studies using thoracic CT imaging of the large airways. These cross-sectional imaging studies have demonstrated a number of things. One, that over half of severe asthmatics in the large severe asthma research program cohort have persistent large airway mucus plugs despite inhaled corticosteroid therapies. Second, the amount of mucus plugging correlates with airflow limitation. And third, that mucus plugs are long-lived within a given pulmonary segment. However, in asthma, along with most other muco-obstructive lung diseases, the mucus obstruction in small airways are sites of early and severe disease. The small airways are not effectively visualized by CT scans, and clinical studies, including the recent Atlanta study, have reported an association between the small airways dysfunction and asthma control and exacerbations. Importantly, the molecular pathophysiology and the characteristics of mucus plugging in small airways disease and asthma are not well characterized.
Well, with that background, what are the aims of your study?
Our study aims to better understand the molecular characteristics of airway epithelium in the peripheral lung. We expand on previous fatal asthma morphology studies by adding the study of VATS biopsies of severe steroid-resistant asthmatics and using innovative technologies, including spatial transcriptomics and multiplex immunostaining, to define the small airway molecular asthmatic phenotype. We hypothesized that asthmatic small airways would have mucus plugging with high expression of the MUC5AC, the secreted mucin known to be upregulated in the large airway in asthma. To test this hypothesis, we characterized small airways and tissues from fatal asthma cases and biopsies from steroid-resistant severe asthmatics. Using ABPAS staining, we showed there is a high mucus plug burden in the bronchioles, the small airways, in both cohorts. We then measured mucin expression of an expression of MUC5AC and MUC5B using RNA in situ hybridization and immunohistochemistry, which showed increased MUC5AC expression distally into the small airways of asthmatics. We found that small airways disease is strikingly heterogeneous in terms of the expression of MUC5AC, both between different airways in a single lung segment and even within a single airway. To better characterize the epithelial heterogeneity of MUC5AC expression in asthma small airways, we performed spatial transcriptomics on both fatal and severe asthma small airway epithelia. We utilized this technology to measure gene expression differences between MUC5AC expressing epithelia and epithelial regions that are not expressing MUC5AC. We compared each of these epithelial regions with control epithelial regions from organ donors whose lungs were not accepted for transplant and lobectomy specimens of individuals without obstructive lung disease. We found that in addition to an increase in goblet cell genes and a loss of the normal small airway secretory cell genes, that the MUC5AC expressing epithelia in asthma also expressed an increase in early developing ciliated cell markers and basal cells. We further investigated the basal cells in these MUC5AC high expressing epithelial regions by using spatial transcriptomics that was segmented specifically using the basal cell marker cytokeratin 5. In these regions, basal cells expressed high levels of genes associated with type 2 inflammatory signatures, specifically IL-33, ALOX15, and periostin. And these findings suggest that basal cells in MUC5AC high epithelial regions are primed to differentiate into MUC5AC expressing goblet cells that then promote mucus plugging. Finally, we used the multiplex immunostaining to identify whether epithelial heterogeneity in these MUC5AC expressing regions was associated with an accumulation of immune cells or whether the immune cells were more homogeneously distributed. These studies reveal that the specific populations of immune cells that we investigated did not co-localize with the MUC5AC expression, which suggests to us an importance of an epithelial intrinsic dysfunction in mucus plugging in the small airways of asthma.
So with this information, where do you plan to go with your research at this point?
So our ongoing work, which is supported by the American Lung Association Allergic Respiratory Diseases Research Award, focuses on better understanding the specific cell type alterations in asthma using single cell sequencing and chromatin accessibility assays in freshly isolated cells from asthmatics and in cell culture systems. These studies aim to identify important changes in gene expression and epigenetic markers of asthmatic goblet cells that produce the mucus found in mucus plugs and in the basal progenitor cells. We want to understand the mechanisms that drive this goblet cell metaplasia and the subsequent MUC5AC dominant mucus plugging in the small airways to reveal potential targets for modulating small airway dysfunction in asthma.
Well, thank you again, Dr. Schworer. We look forward to your further contributions to the field.